Hello YouTube, I'm Dr. Fox. Today, I'm talking about sex during pregnancy. Typically, sexual intercourse during your month of pregnancy is fine as long as there is no particular advice you have received from a medical professional because of a specific condition. Otherwise, sexual intercourse does not harm your baby. There is no way for the baby to be aware of what is occurring either because your partner's penis cannot penetrate your womb. Despite this, your sex drive will fluctuate while pregnant. This shouldn't be of any concern, but it's advisable to be open about your desires or lack of them with your partner. All couples are different, with many still finding sex very fulfilling, while some are cautious or even put off. Of course, there are alternative approaches to personal satisfaction to discuss as well, but that doesn't mean there is any reason to avoid sex or orgasms. Up until the latter stages, there is no risk to your pregnancy in any way. By the time you are in the final stages of pregnancy, some mothers do find that sex can cause mild contractions. During these contractions, womb muscles harden and can cause discomfort, although there is nothing to concern yourself with overall, as this is completely normal. Should this happen to you, take it easy or undergo some kind of relaxation until they have calmed. Okay, there are some key queries. There are examples of common questions about sexual intercourse when you are pregnant. First question: can my baby be damaged by sex? The answer is absolutely not. The baby is protected by the surrounding fluid held in the amniotic sac combined with your uterus, which has very strong muscles for just such a purpose. Other examples of nature's protection include a thick mucus plug that prevents infection by sealing the cervix. The baby is at no risk of being prodded by an erect penis during intercourse. Okay, next. Can contractions be the result of sexual intercourse or an orgasm? For the majority of pregnancies, this is simply not the case. There is no relation between the contractions caused by an orgasm and those felt as labor occurs. Nevertheless, if you happen to have a pregnancy that falls into a higher risk category, then it is wise to consult your medical doctor on how different your circumstances might be. It is likely that medical professionals may advise to avoid sexual intercourse as you close in on those final weeks and days. The reason for this is only a precaution because there is a chemical in semen that can cause contractions, and avoiding any confusion at this stage would be the best approach. Okay, next. Can a miscarriage occur because of sex? The reasons for a miscarriage occurring are typically related to some kind of failed development. There is no risk to the baby from sexual intercourse. Okay, next. Are there examples of sex becoming unsafe for pregnant women or the baby? In this point, it is important to get to know any medical conditions or problems you have had related to an earlier pregnancy. Depending on the problem, your healthcare provider may end up advising against sex. Some examples include if you're expecting twins, triplets, or more. If you have suffered a miscarriage before, meaning a baby has died in your womb before 22 weeks of pregnancy. If so, you may be at more risk of it happening again. Okay, next, for mothers, we have had a premature birth before, born before 37 weeks of pregnancy. This may mean you are more prone to labor starting too early, so sex might be best avoided. Okay, next, if there are issues with your cervix. For some women, their cervix can open far too early and result in a preterm labor. This is called incompetent cervix and means avoiding sex is advisable considering the womb is open. Okay, next, if you have a placenta previa, when a placenta lies too low in the uterus, part or all of the cervix ends up covered. Complications can include severe bleeding. Okay, then let's move to the next question. Is there anything I can do to keep sex safe while pregnant? Sexual intercourse will not harm your gestating baby. Too much natural protection is in place to ensure this, such as the uterus muscles, the amniotic fluid that cushions your baby, and the mucus plug that guards against infection. No male partner is able to make contact with your baby with his penis during sex. Nevertheless, although sex itself is safe, you should still take a safe sex approach. If you gain an infection, then this will inevitably affect your unborn baby. There are some tips. As ever, take the necessary steps to avoid STDs or sexually transmitted diseases. Unprotected sex with a new partner should always come with some safeguards, considering the amount of STDs around today. If you happen to catch one, the consequences can be very serious for your baby. So, if you are unaware of your partner's sexual history, then make sure you use protection. Also, be aware that both oral and anal sex can spread STDs. Being sensitive and conservative regarding your sexual partners during pregnancy is always a good idea, and there is no excuse whatsoever for intercourse with someone you know has an STD. Okay, last question. Can sexual intercourse offer a warning of any problems with my baby? If you experience pain while having intercourse, then you should seek medical advice. Also, for any heavy bleeding that occurs, together with other vaginal discharge or cramps that do not disappear, make sure you treat this as a medical emergency. Some cramp after sex when pregnant can occur, especially after an orgasm, as well as spotting or light bleeding. You may notice this on your underwear, but do not worry if the spotting is so light. It does not cover our underwear.